One, go.
Hello everyone, welcome, a very good evening. I'm Aditi Lamba and tonight you are joining us in ITV Go's exclusive edition on COVID-19 live telecast happening from our studio in New York City. Today and this entire week has been one of many concerning weeks for all of us right now, and this has definitely made the entire community ask many questions, especially our Indian American diaspora. So for all of you that have many questions and concerns, we bring to you very graciously today the Indian Consul General of New York, and we have with us Sandeep Chakravorty. He is the India's highest officer here serving with us, and also is a huge representation of Indian American community, and he has graciously accepted to address some questions and concern and also bring forth Indian government's views on COVID-19 and also how we can help our fellow Indian Americans. So let's welcome on the show again Sandeep Chakravorty. Thank you so much for joining us, sir.
Namaskar. Happy to be on this show.
Sir, I wish I was having you here in better circumstances, but I'm really glad that you've agreed to come to our studio today. This entire week has stunned many people and definitely has impacted everyday lives of not just Americans or Indian Americans, but Indians back home. And when we're looking at this entire situation, it's very confusing and it's evolving right now. So my question to you first would be, how has this impacted you personally and your experience so far, and how is the consulate handling all of these changes that keep on happening on a daily basis?
Thank you, Aditi. I'm happy to be on this show, and I think it's a very good idea to hold this show now because you see, we Indians who live in the United States, we are affected doubly.
Right.
Because of the situation back home in India and also the evolving situation in the United States where we are living. So my first request to all your viewers is that please take adequate precautions. First, here where you are living in the United States.
Right.
Today we saw the advisory which the White House has released. We have seen what is happening in New York. We have seen what is happening in New Jersey.
Yeah.
So I think it's very important that we all remain very safe. And also I know we are concerned about the situation in India, but I think what is very reassuring is the steps the government of India is taking.
Yes.
To control the situation.
Yes.
And we started quite early. I think in January we were one of the first countries to impose the travel ban on people who had traveled to China, and last week we imposed the travel ban on all travel. And today we have a new advisory which says that we will not allow any passengers from Europe. So I think our government has been very proactive. It is taking the right steps.
Yeah.
And the whole ambition or the goal is to make sure that because of transmission, the curve doesn't go up, it flattens out.
Right.
And we delay its expansion and we combat it.
Definitely. And for all our viewers right now, we are live and you may call us. You can reach your Consul General. He will answer your questions. Dial 718-784-8555, extension 108. We are coming live from New York City. When we are talking about this massive impact that has happened on globally, and you were just discussing the response of Indian government, which has been super proactive, a lot sooner than we saw even here in the US. Currently, what are some of the biggest concerns of the Indian government in looking at COVID-19 right now? And also, when you're looking at Indians that are living in India, how do you see that how do you see their daily lives get impacted by this?
You see, I think the government of India is aware that because of the population and the proximity in which we live, COVID can expand quickly.
Right.
But I think we have taken many measures. First one was one point we need to keep in mind is that as so far we do not have community and society spread in India. Our cases are mostly due to travel, and we have been able to trace the travel. In up to 4,000 contacts we have traced people who traveled from either the Middle East or Italy.
Right.
And we have been able to isolate those cases, and we have been able to put those people in quarantine. We have developed quarantine facilities.
Right.
I have some figures here. We have been screening. We have screened in the last several days 1.2 million passengers who arrived in India at 30 airports on 11,406 flights. and we have even traced 4,000 contacts of those people who are carriers, potential carriers, and the numbers of cases so far has been 84. And I think given the Indian size of the Indian population, I think it is a remarkably low number. But you see, we are what is the situation currently and the data that we have, they don't match. The COVID is ahead of us. So in the coming days there may be an expansion, but the whole idea is to control the expansion, to isolate people, not to have social too much of social contact. Social distancing is important, and government today announced several measures, including closure of schools and other measures. I think all these measures will have its effect, and India has been good in combating these kind of epidemics and pandemics. A few years back we had the Nipah virus in Kerala, and our health system is geared to tackle these kind of cases, and I'm confident that we will be able to manage the epidemic. But what I want to ask our viewers is that don't panic. We have to combat the situation jointly. Some of you may have been inconvenienced by the travel ban, but we have to understand that this is for your benefit, for your health, health of your family members, because as Mayor said yesterday, every one of us is a potential carrier of the virus. We may not show it, we may be asymptomatic, but we can be potential carriers, and why subject people to risk? So as far as possible, don't make trips, or don't make non-essential travel. Try to keep your social interactions to the minimum, and I'm sure with all this we will be able to combat the situation.
I would definitely love to go more into the travel restrictions and the advisories, because we've had so many questions, and for everyone watching us, the Indian Consulate was working throughout this past weekend because of these concerns and calls, so we'll definitely be addressing it. Again, we are going live on ITV Gold. Call us with your question. So, but right before addressing those, Indian government just passed $10 million of a funding for coronavirus, and we are looking at a population of 1.3 billion people, the second most populated country in the world. Quick comment on, do you think the entire population has to be really worried in India? And also, you just mentioned shutdowns, and there is news of potential lockdown. Is it primarily a precautionary measure so that it doesn't spread to the 1.3 billion people?
You see, this $10 million which Government of India has announced is not for our health system. It is for a SARC emergency fund. You see, we have taken leadership, and yesterday Prime Minister Modi held a video conference with all the SARC leaders. And he has announced several measures for collaboration between the SARC countries, which include an initial payment of $10 million for a fund. We have even decided to offer a emergency response team of doctors, for online training of doctors of other countries, because pandemics and viruses, they don't know borders. So I think it's a great initiative of the Government of India to work with the SARC countries, and this $10 million is for that particular fund.
I'll address it real quick, but we're getting a call in. Let's hear it real quick. Hello? Hello, what's your name and where are you calling from?
I'm from Long Island, Uday.
Yes, what's your question, sir, or comment?
Subramanian Sitaraman.
Yes, Subramanian ji. What's your question?
First name Subramanian.
Yes.
Last name Sitaraman.
Oh, okay. What's your question, sir?
Pardon?
Okay, I think we may have had a wrong call. Sorry, sir. But continuing more, you were telling us about all these measures that are being taken where India is trying to play a leading role, especially because we are in South Asia and this entire situation is impacting Asia. I know you must have been interacting with members of government a lot. What are some of the emotions and the the feelings you have felt through that? What is the environment there right now? Because we know what's happening here. We have half of the country in chaos.
I think I would like to commend the people of India.
Yes.
Because I think we have taken this situation with a lot of humility and equanimity. We understand the measures the government has taken, and I think in India there is not as much panic as one would have expected. And despite people spreading rumors on social media and basically sharing information and things which are not validated. I think on the whole, the Indian people have handled the situation very calmly and positively, and they are respecting the instructions that they are receiving from the government. They are not they are self-quarantining. They are going into isolation, and even the quarantine facilities, I was seeing some of the videos, are remarkably good, and we have also undertaken an amazing effort in evacuating people from several locations, from China, from South Korea, from Italy, recently from even I believe Iran, and also not only Indians but also foreign nationals. I think we have evacuated more than 40 people of 43 countries. So I think it's a huge effort that has gone in, and there is not much known about this effort, but I think it's remarkable that we have done this. And also what is important to note is that you may have some difficulty because of the travel ban. You may want to go to India, but we should always remember the objective and the spirit behind the travel ban. It is to protect the health, your health, the health of your loved ones, and it is very clear that the transmission and expansion of the virus in India has been because of travel related. We haven't reached the community spread stage, and it will be for our good if we can avoid that and we can flatten the curve. Because you see, any epidemic or viral growth follows a routine bell curve. We are successful if we can flatten the curve and go quickly towards its
stabilize the situation and really control the spread.
And that can only happen if we don't we reduce social contact.
Yes, for sure. I would love to sort of go straight into the travel advisory. We have had multiple questions on it. I know the consulate was open this entire weekend, as you were telling us, answering questions of many people, many concerned people. My first question to you would be, what is the biggest concern you're seeing from Indian Americans that are calling the consulate right now? And the question is it about their families in India, or is it about sort of seeing what their status could be right here, right now?
You see, we have analyzed the queries that we have received on the day the ban was announced. That day we received 1,100 telephone calls. Wow. And I'm not talking about emails and Facebook and
actual
on our calls.
Wow.
And so that's the day we set up our emergency COVID helpline. I think you may show the COVID helpline numbers. The concerns are particularly because all visas have been suspended.
Right.
I repeat the word suspended. So people who have visas and OCIs cannot travel to India. We are, however, making some exceptions, and these are very limited exceptions, particularly in the case of death in the family.
Yes.
But as our Indian American population here is large, 2 million people live in our jurisdiction, even those numbers are big. And also we are making some exceptions if we come to know that a family member is critically ill. So there are some of these areas where we are making exceptions, but you have to appreciate that the systems have been blocked. So every processing, every application is done manually. And that takes time. So we request for your comprehension. If you believe that you deserve an exception, please write to us. Our email addresses are there on our website, and we will very sympathetically and expeditiously consider your request. Another area where there is concern is from students and their parents.
Definitely.
Many campuses have been closed down. There again, we are advising students to avoid travel to India. Because if you have been to Europe and to Middle East, you will be quarantined. There is a possibility of being quarantined. If you develop the symptoms during travel, there will be screening at the airport.
Right.
So there is a possibility of being quarantined for 14 days. So why take that risk? Traveling, airports, aircraft, then reaching India, it's a risk. So if you believe that you can stay here, and if it is absolutely not necessary to travel, then don't travel. This is the basic advisory I would like to share with our viewers, that don't go to India if you can avoid it. But sometimes people have no options. Then we will examine your case, and if you feel that you need to travel, then we will of course try to help you. But we don't want to defeat the spirit of the advisory, which is that we should try to reduce travel, international travel.
Yes, and for everyone, again, there is a helpline that the consulate is providing primarily for COVID-19. Please call the line if you have any questions. And again, as the Consul General said, the visas are suspended and they're not cancelled, correct? So I'm guessing some people are also concerned about when they can travel back. So it's really important for us to address that. So when you're looking at the situation that's following, I kind of want to sort of go more into some of the questions that we got, again with the travel advisory, because it's so detailed, it's constantly changing. Number one, is there any information right now? India is currently not in the list that is banned, from the US to come in or to go out. Any updates on any changes on that? Is this something that we should be concerned about? I know you said we shouldn't travel if it's not essential, but should those people be concerned that are planning to travel?
You see, I cannot forecast how the situation will evolve.
Right.
You just see the advisory which was issued today by our Ministry of Health and Family Welfare, which very categorically says, it has been put on our website as well, that there is compulsory quarantine for a minimum of 14 days for passengers coming from or transiting through UAE, Qatar, Oman and Kuwait.
Yes.
Now if an Indian national
Yes.
travels to India on, let's say, an airline transiting through UAE, you will be subject to quarantine. So
Okay.
that is something one should keep in mind, because many people travel on these Middle Eastern carriers into
Right.
India.
Yeah.
So one has to be very careful, and that will come into effect from 1200 GMT on March 18th at the first port of departure.
Wow.
Secondly, travel of passengers from European Union member countries, Turkey and UK to India has been prohibited. So even if you are an Indian national and you live in the UK,
Yes.
you cannot travel to India right now. So, and these will remain in force till we believe we have been able to flatten the curve and stop the expansion and transmission of the virus. So my suggestion to all of you is that avoid non-essential travel. In case you feel that you have to travel, particularly there have been cases of Indian citizens who were on H1 visa and the
Right.
visas have expired.
Yes.
But they have children who were born here, minors,
Yes.
and they need to go back. So in those cases, we will be making exceptions. But our whole ambition is to keep those exceptions to the bare minimum.
What, in case of these quarantines that, you are discussing, and since we have you here, and I know you said that you've seen some videos of them, could you sort of give us an insight into what is happening in these quarantines? And as you said, if you develop a symptom on the plane, you are subject to screening, and if it comes out, you could be quarantined. So that is a matter of concern. What exactly happens there?
Quarantine is basically keeping you in isolation. We have many people in quarantine, and I would say that there is no harm in being in quarantine as such.
Right.
But you will be cut off from your family and the world for 14 days. You will not be allowed to move out and interact with anybody. It's
Yes.
like self-isolation. So that may not be a very pleasurable situation for many people. But if you want to subject yourself to that risk, you can travel. But again, you see, we don't know how the travel ban will play out.
Right.
We didn't have this advisory till yesterday.
Yeah.
And a few days back, President Trump also banned all European flights, and
Yes.
I believe now UK and Ireland may have been added to that list. So the whole idea, the effort of the entire world government is to prevent the migration of the virus, so that it remains in place and it dies out wherever it is present.
Right, and then, for Indian Americans that are living here, the community is very concerned, sir. And again, we are talking about the students that you had reflected upon. I am talking about universities such as Columbia and, high Ivy League institutions that have either decided to suspend their entire semester or have suspended it for enough weeks. Some of them have asked the students to vacate their premises, the dorms. A lot of these graduate students that travel from India are on student visas, are only living in their dorms, and that is their home to them. We saw many videos and posters of people holding posters saying, I have nowhere to go. Not too many Indians, but I have seen that with other immigrant communities. How has the consulate been handling the situation? I would love for you to give us some insight into how the students should be handling it. Perhaps help us calm us down.
This is one of the fallouts of what has happened in the US
Right.
with COVID-19, because many universities have closed down and have asked students to vacate the dorms, and many of the students don't have any place to stay. So I would like to request our community and community organizations to step forward, and if you can offer temporary housing to the students, it will be of great service to your country and to your fellow countrymen. What we have done is that we are coordinating efforts.
Right.
Many organizations have come forward. API has come forward.
Oh, wow.
TANA has come forward. We know people in Cleveland who have come forward. We have the Hindu Sevak Sangh, HSS.
Yes.
They have come forward. In fact, they have issued a poster with helpline numbers for all over the United States. We are working closely with them. We also have an education helpline in the consulate, education.newyork@mea.gov.in. It's available on our website. If you have any student has a query and needs help, we will be able to connect you to people who can offer you that help. But once again, I would request the community to step forward. To offer housing to the students who have nowhere to go, because it is not advisable to travel to India, and many of them have a visa status where if they go back to India, then they will not be able to finish their education, or they will not be able to finish their optional practical training. So it's a matter of concern, and we are trying to deal with it. There is a big effort going on, coordinated by our embassy in Washington, and we have been issuing some advisories on this as well, and I would request people to connect to us again on students particularly who need help, and we will try to connect you to community members.
And this help could be in terms of accommodation, in terms of them figuring out what is happening with their visas, in terms of them just figuring out where they should go in the situation. Again, everyone, the consulate has a helpline. Make sure you connect with it. Make sure you ask your questions so they can help you out. You just had mentioned the Indian embassy in Washington. Again, a huge representation of India for Indian Americans and internationals here. What has your communication been with them like? And, together, I know the concern is it shouldn't spread, but there are many things that are concerning Indian Americans, businesses that work between India and the US, people that travel on a frequent basis, many educational venues as well. We're talking about schools and students. What is the thought process right now in those regards, and how are you both communicating? You see,
there is a great deal of coordination which is going on between amongst the embassy and the 5 consulates. We are fully aware of under the leadership of our ambassador, we are all communicating and coordinating, and we are stepping in to help each other. There is a possibility that one or more of our consulates may also enter into the lockdown situation. There we will chip in and support, and particularly the education effort is being coordinated very well from our Washington embassy, and we are reaching out to our community members, and I think it's an entire effort of all the consulates and our embassy, and we are frequently communicating. In fact, we are over communicating so that we follow the same policies in all over the United States.
Yes. Should businesses be concerned, Consul General, according to you, the businesses that are dealing with Indo-US relationships, businesses that are investing, businesses that are going back and forth, your take on that?
I believe that this is a temporary phenomena. We will overcome COVID as we have overcome other such epidemics or pandemics, and there may be a setback, but I think it will be temporary. COVID also throws up opportunities. It also requires you to change your plans, to change your sourcing, to change your game plan of your strategies. And I believe that businesses and companies which are working in the Indo-US corridors, they are very resilient. They are good companies, and I'm sure they are having contingency plans on how to come out of this emergency. And we are all looking at a world post-COVID, because otherwise, what are we doing? So I am an optimist, and I am already planning for how and what we will do when this epidemic subsides.
So you've been in the Indian Foreign Service since 1996. You have served in missions in Bolivia, Spain, Peru, in Bangladesh. You have traveled so much, and you're also a parent, and you're also a husband. Have you seen situations with this intensity? We have a caller. Let me quickly take a call. Yes. Hello, welcome to ITV Gold. Who's calling?
Hello, this is Raj. I'm from New Jersey.
Hi Raj, thank you so much for calling us from New Jersey. What's your question or comment?
So my question was next month I was planning to travel to India, but because of this coronavirus and all that, I'm unsure of what should I do now.
Okay, and should I ask him if he's a citizen or if he's...
Yeah, ask him.
So are you a US citizen or are you a visa holder or an OCI or a green card holder?
I'm an Indian passport holder.
You're an Indian passport holder. Are you on a visa
Yeah.
right now?
Yeah, I'm on a visa right now.
Okay, should I ask him what kind?
That's okay.
Okay.
No, I thank you for calling. I would strongly recommend that you don't travel to India till the travel ban has been imposed, which is April 15th. So just wait and be where you are and follow the basic precautions that the government has announced. Both the Indian and the US government have announced, and I'm sure things will get under control, and we should look at a different scenario in the coming months. So I would strongly advise that you stay put where you are and travel only after April 15th.
Yes.
Okay.
Thank you so much for
Thank you.
calling us, and I wish you safe health and well-being. Thank you so much.
Yeah.
You know, we did miss a few calls, everyone. We're still going live. Please call us on 718-784-8555 extension 108. We are taking calls right now. You know, right before the call, I was asking you
Yes.
about your experience.
No, I personally, have not encountered this kind of
Yes.
of situation ever, because it has basically upended all our work, our planning, our the biggest challenge is right now is well-being and safety of our employees who work.
That's true.
They live in different parts of New York, and
Right.
they commute, they use public transport,
Yes.
and my constant worry is that none of them should be infected. So we are taking precautions, but as the mayor de Blasio said, everyone is potentially exposed to the
Yes.
virus. So that is a big challenge, and also in this environment you can't think of anything else like COVID. But I believe that we need to be need to take precautions, as Prime Minister said, but we should not panic. In the moment we are panicking, I think we lose the game.
We have another call coming in. Hello, welcome to ITV Gold. What's your name? Where are you calling from?
My name is Ashok and I'm calling from Cleveland.
Yes, Ashok from Cleveland. What's
Hello
your
Ashok,
question?
how are you?
Doing good, sir. How are you, sir?
Very good. Please tell the viewers what you are doing to help the students in Cleveland.
Oh, this is the call from Cleveland.
Yeah, from Cleveland.
Yes, sir. Tell us about all the incredible work.
So, I represent from Tana Telugu Association of North America. So, since the corona outrage that has happened, so we came forward to assist all the students with temporary accommodation and hospitality.
Yes.
So as soon as we reached out to the local businesses, many people, many families came out and they said that they want to host the students and they want to provide accommodation for them, which is a good sign the community is coming together. So when we saw the news from the Consulate and from New York, so we are really like students were really happy, because one thing is like they have we were there to help them, and another thing is like in a bigger scale the Consulate is already approaching most of the student unions, the student associations,
Yes.
and checking with them the safety and everything. So it's a good thing.
Well, very nice. And this is from Tana?
From Tana,
Cleveland.
Cleveland.
So would you recommend them to just go on your website and find more information and also contact the consulate if they have any questions?
Sure, ma'am. And we also open our helpline.
Yes.
1855 Avartana, OURTANA. So
1855 Avartana.
Yeah, 1855 Avartana.
Okay.
Yes.
Well, thank you so much for your call, sir, and really appreciate your effort.
Thank you so much.
Thank you Ashok, thanks
Thank
for all
you so
that you're
much.
doing.
Thank you.
Thank you, sir. Thank you. Bye.
Wow, 1855 Avartana. Wow, it is incredibly going on here. It's important for all of us to note that there are these lines, everyone. Helplines are available. Please connect with them. Please contact them. So, we are coming towards a close of this interview, and I really appreciate you for your time. My question to you is, how are you looking at the next few steps for the consulate in the next coming weeks? I know you all have been working very hard. The consulate members have had some great conversations with me on all the efforts you're doing. What are some of your focuses right now?
You see, first is to be safe ourselves.
Yes.
And that's important, and we are trying to follow closely the advisory that the US government has issued, and we are encouraging everyone to follow that. So that is our first objective. Secondly, we are advising people not to panic. We should be prepared, and we are taking a step-by-step approach, and we are trying to also understand the steps the government of India is taking and explain it to the people. I am on your show today. I'll be on other television shows. I'm giving interviews. The whole idea is that we need to deal with this very calmly.
Yes.
And for instance, not traveling is one part of it, but also advise your family members back home on what to do.
Yes.
Don't spread rumors. Don't spread all bogus information that is coming out. In fact, I was quite disappointed with some of the media coverage that came in the American media.
Yes. About
India being unprepared to handle the COVID-19 epidemic, which is very far from the truth. Some so-called experts gave their opinion, and they have not reflected on what the government is doing. So I think those also do great damage, and
Yes.
they create panic and distrust in the system. Now is the time to have trust in the system.
Yes.
And let the people who know best to handle. If you see on US television, whenever president comes, he brings Tony Fauci.
Yes.
And he inspires confidence in all the viewers. And I fully believe what Tony Fauci is saying is that jointly, if we maintain social distance,
Yes.
if we don't go out, don't go to big parties, and keep away from each other, we'll be able to break the back of the virus.
Thank you so much for your time.
Thank you.
We are running out of time right now. Thank you so much for joining us, everyone, on ITV Gold. Again, the Consulate General of India, New York is open to help you. Please call them, reach out to them, email them, use the helplines, and we hope that all your questions get answered. Thank you for joining us on ITV Gold's COVID-19 Special Edition. We'll be back with a lot more.